Dr. Drake. Next, Bruce Squires, President and Chair of the Board of Directors of Children's Healthcare Canada. Welcome to the committee. Mr. Squires, you have the floor.
Thank you very much and good morning. Really appreciate this opportunity to speak to you about this vitally important topic. As noted, I'm joining you today as President McMaster Children's Hospital and as Chair of the Board of Directors of Children's Healthcare Canada. I'll note that I'm joining from Hamilton, which is located on the traditional territories of Mississauga and the Haudenosaunee Nations and within the lands protected by the Dish with One Spoon Wampum Agreement. McMaster Children's Hospital is one of the 16 dedicated children's hospitals across Canada. We serve a catchment area of 2.5 million people, including 500,000 children, youth, and their families, provide a comprehensive specialized healthcare to newborn children and youth and their families from across this region. And I, like all of the others you heard from today, are here because our teams and the families they serve believe we need to sound the alarm on the health and well-being on Canada's children and youth, and we need to make their health a top priority going forward. Our teams and the families are worried that what they see and experience directly is not recognized by the public nor by our leaders, and they believe we need a clear commitment to refocus on the health of our kids. In my view, that's the greatest opportunity for this study of your standing committee. So why do we need to sound that alarm? You've already heard from my colleagues. You've heard about the 2020 UNICEF report card. Canada ranks 30th and 31st for children's physical and mental health respectively, out of 38 OECD countries. And we're in the bottom third of the report for such key indicators as child mortality, obesity, teen suicide, and immunizations. In a country as rich and as developed as Canada, it's inconceivable to most of us that we're performing so poorly. And those working directly with children, youth, and families in schools and community agencies and hospitals, they're not surprised by those figures. That's because they see the impacts on a day-to-day basis. Our mental health teams see the children who've been waiting as long as 2.5 years to access specialized mental health services. Our child development rehab teams struggle to support parents of children needing school-based rehab as they wait 3 years for those. And our inpatient teams struggle to provide care to critically ill children and youth following suicide attempts, overdose and substance use, and severe eating disorders. Now, that data was collected before the pandemic. And now, as you've heard, Canada's children and youth have borne the brunt. Their development, physical, emotional, social, spiritual, has been impacted severely by learning loss, reductions in access to physical activity, social isolation, and delays in access to care. And again, the data are striking. You've heard from Dr. Doan about the mental health of Canada's children. McMaster Children's Hospital, we've seen a doubling of admissions to our inpatient wards for treatment for substance use disorders and a 90% increase in admissions to our eating disorders inpatient treatment unit. Delays in care and increases in demand aren't limited to mental health. You've heard from Dr. Drake. Think about that. Here at MCH, nearly 2/3 of parents of children waiting for surgery have already seen their kids miss the recommended window. Across Canada, hospitals are experiencing unprecedented volumes, occupancy, and waits. This morning at MCH, our emergency department had 10 children who had been admitted to the hospital, but were waiting because we didn't have an inpatient bed. And that's because we were operating at 119% occupancy of those beds as of yesterday. What those numbers really mean is kids waiting as much as more than 24 hours and critically ill children and their families being transferred across the province, for example, from Hamilton to Ottawa, because we don't have an ICU bed. And I could go on and on. The data clearly paint a picture that the health of Canada's children and youth is not where it should be. That leads to what I think really is the overriding ask for this committee, that you recommend that Canada prioritize improving the health and well-being of our children and youth. There's great impact from the federal government making a public commitment to work with others to prioritize improving the lives of kids. That will, of course, need to be followed by tangible actions, and you've heard excellent recommendations from experts over the past few days. I would add, first, the Inspiring Healthy Futures report can form the basis for the development of a pan-Canadian child and youth health strategy. That is the key first step. I'd call out some additional key developments. Canada requires a sustained and focused effort to understand and report on the healthcare of our children and youth. We need to collect extensive data on a longitudinal basis to inform best policy and action. That will link directly to the need for targeted child and youth mental health research agenda, targeted towards new knowledge on maternal, newborn, child, and youth health. That in turn points towards better support and coordination for the sharing, dissemination, mobilization, and adoption of that knowledge across the country. And thirdly, I'd highlight again a couple of the most pressing areas for focus of a child health strategy. Improving access to specialized services for rural, remote, particularly Indigenous populations remains critical to addressing health disparities and promoting health equity in children's healthcare and health. Children and youth require timely access to appropriate mental health services close to home. A commitment to earmarking 25% of the Canada mental health transfer for children under 18 would be a crucial first step. And there are so many other key areas you've heard. As I close, I'd like to thank all of the members of the committee for your decision to undertake the study of child health. As I said, this is a crucial first step towards beginning to address the crisis that we see in child and youth health across Canada. It's my hope that that first step will lead you to recommend a public commitment and associated action steps to prioritize kids' health and well-being across Canada. Thank you sincerely for your time and attention.
Thank you, Mr. Squires. We're going to now proceed with rounds of questions, beginning with Dr. Ellis for 6 minutes.
Well, thank you, Chair, and thank you all the witnesses for being here today. Certainly, it's clear that the difficulties facing children are perhaps certainly as great those with adults and perhaps even greater.